Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. And today we're going to showcase how we can fix temple scars. So I'm going to go through the steps that I do for temple scars and walk you through how I particularly took care of this patient. He's a young gentleman who is really worried about his temples. So I'm going to basically go through all the different things that we could do for temples and what I find to be really the best options for temple scars. So I'll walk you through that right now and kind of showcase for you what I think for patients who have temple scars really should do and how we could actually make sure that these scars that tend to be pretty stubborn, pretty thick, can be managed safely in skin of color particularly, but all skin types as well. So I'll walk you through that. What a lot of times I have this question for temple scars, especially with young men actually. Really interestingly enough, I find that it's possible because it's tough to cover up the temples in men. It's something that it can be particularly concerning for men. So I'll show for everybody that's just joining us, I'm Dr. Qazi, a skin restoration specialist in Newport Beach, California, and we're going to be talking today about temple scars. I did a lot of temple scars the last couple of weeks, and I want to kind of explain just that process for the scars and also how we could do it, of course, safely and effectively for patients. With this particular patient, you could see we had a really, really nice improvement of his scars. What we did was actually we did something where we did a little bit of TCA Cross, as well as in his case, we used more of an ablative CO2 laser for the edges of the scar. And then we also did something called Bellafill, which is a long-lasting permanent filler that we could actually place and provide at least 20% improvement perpetually underneath those scars. And what it does is it stimulates more collagen production so that your scars can improve over and over for years to come. So you can see that process as well over here. So we have a really, really amazing result for scars with temples. And one of the reasons why is because you don't just focus, especially in the temple area, just on energy devices. You want to make sure that you solve that volume issue because the temples really don't have too much volume to give. So a little bit of fat destruction from scars can really go a long way. Let's see here. Devco is saying thoughts on Gessner's peels for texture. I like it a lot actually for mild texture. If it's pretty mild, I think it's a good peel. Really low downtime. The VI peel is basically like a modified Gessner's peel. Works really well. So we do that actually. So I do like that again. Oh, hi Martin. How's it going? Good seeing you on. Let me know if the audio is okay for everybody. I kind of switched my my layout a little bit here, so hopefully there's not much of an echo or anything like that. Soul Matcha is saying, you've said you don't like temporary fillers because you've seen a lot of migration. However, aren't temporary fillers still safer given that you'll at least have the opportunity to dissolve? Good question. And well, it's not just that I don't like temporary fillers because of migration, although that's part of it. You know, basically with hyaluronic acid fillers, when you do it, it's in the superficial part of the skin where we need to do it for scars. I do find that it could shift and it could draw in some more water than it's worth. And so then what ends up happening is that sometimes it's really was supposed to be in one part of the skin, and then it kind of goes towards maybe like where that the bumpy part of the scar is instead, and it doesn't look as nice over time. And the other thing with it is that it doesn't stimulate the kind of collagen production that you could get from something like Bellafill or Sculptra or Radiesse. So those are all important things that I factor into this. The other issue with hyaluronic acid fillers is some of the products are really, really difficult to actually dissolve. It's not so much that, it's not as easy to dissolve as some people think. Not everybody has an ultrasound. Like I have an ultrasound, I could do that. And but not everybody does. And so it's something just to pay attention to that, there's some people that are going to do hyaluronic acid fillers and they don't necessarily know how to get rid of it. And, it could shift and migrate and cause lumps and bumps, and which is a big problem there. So I think that one thing that we really should try and focus on with fillers is, of course, proper placement, but also the right product. So personally, I don't love hyaluronic acid fillers because it doesn't stimulate enough collagen. The question is that if you could dissolve Bellafill, you don't dissolve Bellafill, but what you could do is you could reduce the collagen production that's around it. Sometimes it could be too robust of a collagen response sometimes. And so you could do a little bit of a steroid injection or something with 5-FU, and that'll actually help relax that collagen response and help soften it. But if you're concerned with more permanent products, then of course we could do hyaluronic acid fillers. It's not like it's more for your sake. I'm trying to say do the collagen production, I should say collagen producing products, because I want you to have something that's long lasting. I want you to have something that's going to improve the scars. I'm somebody who loves Bellafill because it worked so well on my face, and so that's why I talk about it. But I don't really necessarily, I should say I don't necessarily push people away from hyaluronic acid fillers completely. I'll say, if you want that, that's what I'll do. If you really want it, I'll let you do it. But it's not necessary from my end, to improve scars. I think there's a lot of different options, especially collagen-based products are going to be the best option in my mind. How well does Accutane work for scars? Well, the thing with Accutane is that it reduces oil production, which can help sometimes with the diameter of some of the scars. So it can reduce the diameter, and that can make some of the scars look a lot better, because also you could get more of a collagen response then too. There's less inflammation, less of that bacteria on the surface of your skin, and that ends up having so that you could get a little bit more of the collagen response. Will punch excision reduce the diameter of a singular scar? Punch excision is not necessarily going to reduce it of a singular scar if it's like particularly shallow, but it would reduce it if it's something that's a little bit, let's say if it's a little bit of a wider, deeper scar, then yes, we could essentially make it into a more narrow scar, a more superficial scar. But sometimes what ends up happening is though that for singular scars, it's particularly in certain spots, that if somebody does a punch excision, they may end up having it so that it caused a little bit too much tension in the skin. So it just depends on where the location of the scar is, and we're always testing to make sure that it's a proper location for all of our scars. So I think that a lot of times you'll see, like, I'm just going to be playing around with the skin, testing to see where it's at. Maureen, where is your scar located actually? Where on your face is it on there? Hi, Alan. How's it going, by the way? Hope you're doing well. I think that my layout, I guess some people are saying that my layout is different right now. I did it a little bit different. Let me see if it was too confusing. I'll try to see if I can flip it during the live, but if I can't, that's okay. We'll stick with it for right now. We'll power through it. Let's see here. Let's see. Bree Bless is saying, Doctor, I am planning on going on birth control. Will it affect my acne scar treatment? And is there any way to fade this without a medical procedure being done, like laser microneedling? Well, your birth control could help because it'll reduce your oil production. And then on top of it, the other thing is that it will actually hopefully prevent future acne. Depends on what kind of birth control you're on, though. It usually should be on estrogen and progesterone both. That's probably going to be the best option for you. But that's a good thing if we don't have acne. Let's see here. The sound sounds awful. Are you guys having problems with the audio today? Hopefully it's not too bad, but maybe I messed it up because I just did a new setup right now. So maybe the sound's not great right now for you guys. Let's see here. Will microneedling help? Not so much for these kind of scars. Sometimes it helps a little bit for some mild scars, but not so much for these kind of scars, to be honest with you. Sound is perfect for you guys. Awesome. Okay, good. Oh, you like the new layout. Okay, good. I'm hearing positive things. I was trying something different there, so that's good. Let's see here. So Macha is saying, in many instances, you do subcision, TCA lasers, and fillers. However, in other instances, you do filler after the treatments. How do you decide? It depends on the location of the scars. Sometimes if the scars are in the lower part of the face, we got to be pretty careful with any filler. Sometimes I'll take a look at your anatomy and say that really, especially with certain ethnicities, we have like really high cheekbones. We definitely don't want to put too much filler in certain spots there, even if there were scars there. So I'm going to really have to pay attention to that when I'm looking at the patients beforehand. I'm going to be testing it to see where the location of the scars are, to see where the volume loss is, and if it's going to shift or make your natural anatomy a little bit different. That's what I pay attention to. But if I'm pretty comfortable and confident that these spots, we could put a little bit of filler at the same time, I'll do that. I'll make it a little bit easier for you, especially a lot of my patients, more than 60% of our patients are from out of state. So I will be able to help with that if I need to do a little bit of filler or volume that same day. But if I'm saying I can't do it, it's because really it's potentially not going to give you the best possible option, honestly. Unfortunately, we probably just have to wait to do that in the future. Sorry, but I definitely want to keep it so that you look really natural and really great for forever. The goal is that like this is something that I want you over and over and over again, just to look really good for years and years and years. And in fact, it should look better and better and better for you. That's what I want. Sailor Moon saying I did yours. It looks amazing. Awesome, Sailor Moon. Thank you so much for coming on. And what did I do for this patient? This patient, what we did was we did TCA Cross. We did ablative CO2 laser for the edges of the scar. We did Bellafill as well for him. And we did a fraction laser as well. So we did a few different things, not just one treatment because, I should say not just one thing at one time, because we really wanted to give a little bit of volume. We wanted to improve improve the texture of the skin. And we did all that in this case under a single session. And in the cheek, actually, I'm actually talking about the temple area, but in the cheek area, I did do talar liberator subcision for this patient as well. Will derma stamp work? It may help a little bit. It's not going to help too much, but it may help a little bit there. Thank you so much, Alan. Alan just came in for another treatment. We started his process earlier this year. He had very, very deep scars. He's looking incredible right now. He just came in on Friday, and his results are going to look amazing. We're going to see him again probably in February or so, Alan. I think it's going to be even better at that point. I think it's going to be really, really nice. We're just continuously getting better and better. And I would say, honestly, for Alan, with the depth of his scars, it's going to be about a year and a half of some of these type of little bit of collagen here and there, some resurfacing. And you can see it for what he's saying. He's saying that Alan is saying, what did Alan say? I'm going to put this. I'm going to read out what Alan says because it's really nice. Thank you so much, by the way. Alan says, Dr. Qazi is the best and you will see the best results than going with any other doctor. Thank you so much, Alan, for that. And appreciate it. And it's going to get better and better and better over time, which is really fun. Chris is saying, I'm 16 and I had deep scars, but tretinoin did the trick for you. Awesome. I'm glad it did. I'm glad just minimally invasive things did that. Alan is saying he's going to come back in 6 months for another step for the treatments. And that's awesome because we want to go a little bit stronger. Probably what I did with him was last year, I did more like in about February time, I did more of an ablative CO2 laser at that time. I usually wait almost about a year after to do another ablative CO2 laser. Autumn is saying, do you do skin restoration for intimate area from scratching from eczema? Yes, I do. I could definitely help with that. And it's more common than you may think. It really is. Miriam is asking, it's on the apple of my cheek. Can punch excision make the scar worse? So apple of the cheek, you have a little bit of tension, but if it's going along really where these lines are, where you smile, then it probably should be okay. Then we could do that and it really hopefully will reduce the diameter of that scar. Let's see here. So Matcha saying, when I search online, I'm surprised by the lack of physicians who use Bellafill. Why is that? Well, it's possible that people just were never trained properly in doing filler in the first place, like a regular filler. Really most people just aren't trained in doing filler anyways. And unfortunately, some people that are trained in doing filler, their habits aren't the best. Some people who have volume loss in the mid cheek, what happens is that people overfill that area and they're used to doing it really superficial with hyaluronic acid that could shift in that area and they run into more problems. And they do the same thing with Bellafill, and now you're doing a more permanent product and you can run into a lot of problems. I had somebody who was in my building before and she was so shocked about how I was doing Bellafill and said that when she did filler before years ago, she ended up getting lumps and things like that. But she gets lumps like that also with hyaluronic acid filler. And I've seen the way the injection technique was, which was really, really heavy. And it was potentially it would cause lumps then. And so if you're doing something like that, then you potentially could cause lumps with Bellafill as well. So I would definitely say that if people are concerned with their injection techniques, they really should not be doing something like Bellafill. It is a very high risk not high risk laser, but a high risk product, because it is more permanent. And so we got to be very, very careful as we inject. I had another patient that somebody injected it in the nose area, and she ended up getting, it looked almost like it was potentially ischemia, things like that. And, I don't even think that person injected that much ever before. So it's like shocking that they would do a very high risk area like the nose with a permanent product like Bellafill. Really concerning, actually, in a way. It was a dermatologist that apparently did that, and now was left with an unfortunate scar that we're going to have to work with and improve. How much is a lower facelift for a more defined jawline? I don't know what our prices are for facelifts offhand. You'll have to do a consultation with us to see that. Usually most of our prices are online, but I know for facelift that's going to vary though. Let's see here. Chris is saying that he did, the tretinoin worked out well, so perfect. Is tretinoin safe for rosacea? It's potentially could trigger or make rosacea worse. So not the go-to typically for rosacea. Usually if you want something for a little bit of resurfacing, you could try something like azelaic acid would be okay. Do most doctors do a test patch for Bellafill? Most doctors don't actually, we're happy to do it if you request it, but it's certainly, I think, fallen out of favor at this point. And from what I'm hearing is that it's even dropping from like the FDA guidelines as well. But we absolutely could do it. And if you are concerned, you're somebody who's like has a vegan diet or doesn't eat much meat at all or anything like that, you're worried that you have a bovine allergy, a cow allergy, then yes, we should definitely try it. Or if you have other autoimmune conditions, yes, we should check it. Does volume from Bellafill stay forever? That 20% does. So that will just continuously stay there. What are the risks for injecting into the temple? Well, with the cannula, it's very safe. There is a risk. There was somebody who is pretty popular over here who was saying that essentially what they do is they just do a single shot of the needle down to the bone, and they do a big bolus of filler in that spot. And that's actually risky. That's actually very, very risky the way they do it, because you could actually get the vessel deep to the bone, and you could actually go directly into the vessel with filler there. But with the cannula, what I did with this patient, that's actually a lot safer. That's going to be okay for our patients. So that's what I recommend doing actually with a cannula for the temple area. Is subcision effective, and how many sessions on average are needed? Subcision can be super effective for the right patient. Like you can see for this patient's mid cheek over there, we did, or I should say his lateral cheek as well as mid cheek. You could see that we did subcision over here. We did talar liberator subcision in this case, and we ended up breaking up that scar tissue really effectively. So yes, it was definitely necessary for these deep rolling scars. We did some subcision in the temple area as well, and some Bellafill over here. What is the first step to improving? The first step is to control your oil, control your acne, and that's going to allow us to get a really, really nice, robust result afterwards. So that's definitely the first step actually for this. Second step is going to be if you have rolling scars, do something with some subcision. Also for those deep ice pick scars, we would want to do something like TCA Cross for those. We also could see something where we have those thick edges around the scars, and that's where CO2 laser, like ablative CO2 laser would work for some of those spots. So will permanent fillers become illegal in the U.S. now? Well, silicone is is illegal, but Bellafill is currently the only FDA-approved product for scars. So it is FDA approved. So it's not that that all permanent fillers it's considered in the category of semi-permanent, but the process really, it's difficult to say if really that PMMA really does ever get absorbed. They stopped the study after 5 years, but there's a lot of patients who will have it for a lot longer than that, and it's likely that it doesn't get absorbed by the skin. Rusty is saying, is it normal to purge after CO2? Good question. Yeah. So it is normal, actually. You could get a little bit more oil production because your skin is so dry. So it really is a sign that you really should be moisturizing a lot more. Really, that's something to pay attention to. You may need like a topical antibiotic or an oral antibiotic to help break that up. Francisco saying, what about the skin that looks similar to a butt due to microneedling? Well, it'd be tough to say that you could get that from these kind of scars with microneedling. In fact, this patient did a bunch of microneedling sessions and did nothing for his scars, he said. So a bunch. I think he did like 10. 10 or 12 or so. Noah is saying, I have pretty mild acne scars on my smile area. How long will it take for tretinoin to get rid of it? Well, it's mild, so you could try it for like 6 months or so. That may be okay, but otherwise it's unlikely to solve most scars, so to be honest with you. What type of scars can microneedling be most effective with? Really mild superficial scars with a little bit of texture, like a very, very mild, maybe that will help with. I'm just in general not a fan of microneedling because like something like this, this patient had done about 10 sessions, I believe, of microneedling, didn't help him out. So not something I particularly love for scars, to be honest with you. Would you recommend adapalene 0.3% or retinol 1%? Usually adapalene, well, it depends on what you're trying to solve. Adapalene is a great option though for, especially 0.3%, a great option there for patients who have some oil production. Retinol 1.0%, maybe a little bit for more like fine lines, wrinkles, but adapalene potentially could help a little bit more for the oil production. Mikhail is saying, I had fillers on my temple, but it was too much. It restricts veins, so they had to dissolve. What to do? Well, are you saying that you had an occlusion? That's a little bit different. Are you saying that it was basically went into a blood vessel? Because otherwise, I don't know why it would be something that you would have to get rid of, to be honest with you. If that's the case. I'm not sure if that's what happened to you when you're doing it. Let's see. MJK is saying the older the scars get, are they harder to get rid of? Well, definitely it's better to treat it earlier. Definitely you could get a more robust collagen response, but we could still ultimately get a really nice response. It could take a little bit longer. It just depends. Can you apply PRP with subcision and laser? Yes, it could help with the healing process, but it's just really not going to change too much for scars. But yes, it could help with the healing process for this though. So I would recommend it for that portion. Can you apply PRP? Oh, I read that. What's the treatment for PIH? Usually it's a pico laser if we have PIH. So usually we do it with more of the pico laser there. Are you guys able to see this, by the way, with the new format? You guys can see it well. You could do a widescreen, by the way, too. I made it so you could do widescreen now. Let's see here. Hi, Bao Kimmy. How's it going, by the way? Let's see here. Where was I at? I know I missed a bunch of questions here. I'm going to try to catch up on some of these questions here. I have one very visible boxcar scar on the apple of my cheek from acne. How do you usually treat those? Boxcar scars, a little bit of laser on the edges of the scar, and then maybe something like Bellafill there as well, just to lift it up a little bit there. Maybe just a little bit of that. So that's probably what I would do for a boxcar scar. But usually you want to do a little bit of laser to soften up the edges there. Okay, so someone's saying that they have the same kinds of scars on their temples and cheeks. How did we do this? So just to recap, basically in this case, we did TCA Cross. We also did a little bit of ablative CO2 laser. We did subcision, talar liberator subcision in the cheek. We did some subcision in the temples as well as Bellafill over here. So that's what we did for that. What are the main factors that cause scarring? Really, it's mostly genetic, really. Some people do pick at it. Some people do other different treatments. But mostly the main factor is going to be genetics, to be honest with you. Luigi. Someone's saying Luigi there. Okay, so what's the protocol to microneedle if you're prone to cold sores? You should do something to suppress it. Usually what we do is we have some sort of antiviral, which we use for a few days before you do your treatment, and then you do it for a few days afterwards. Nimrata is saying, what's the best laser to help with acne scars? Well, it depends. I mean, this was not just with laser. This was a few things. It's with subcision, it's with TCA Cross, it's with Bellafill, and it's with laser. So the laser that we're using is basically where you see like those rough edges of the scar. Actually, I could zoom in a little bit so you can see a little bit better. So I'll go zoom in here. Let me see if you can get really close to it. Let's see if you can see it well this way. So hopefully it's a little bit closer. So if you see it this way, you can see that there's like this thickness around the scars. And that's where I use more of an ablative CO2 laser for that. And that helped out really, really well. That helps soften it up really well. So ablative CO2 for just those portions of the scars. And then I use a fractionated blend elsewhere. Let's see here. Let's get smaller. So hopefully that hopefully helped you out there. But you can see in the temple area, there's not that much room there. So if you end up basically getting some scarring over there, it could destroy your fat pretty quickly, which is a big problem for a lot of patients. If it destroys the fat pretty rapidly, and that can be frustrating for a lot of patients as well. Oh, nothing moved. Oh, okay. I did it on some other streaming platforms there, which I cannot mention because they say you can't mention things. Okay, so here you go. Look at this. I think it should be better now, right? Hopefully bigger. How about microchanneling for atrophic scarring? It can help a little bit. It's not going to help too much, though, to be honest with you. Let's see. I'm going to try to make this bigger here. There, maybe it got bigger now for you. Nothing moved still. Okay, all right. How about this? Hopefully it's better now. Okay, I missed a bunch of questions here. I know I'm way behind on the questions here, so I'm going to try to catch up over here. So yeah, you can see, hopefully it's a little bit clearer, a little bit bigger for everybody. You actually could make this, I changed the thing now, so you can make a widescreen format, make it a widescreen format actually. It's pretty cool. New tech. Look at that. Widescreen format. Okay, some redness. Yeah, so we just did it a month ago, so some redness still. Why do I have red spots in places where there's no acne? And that's a good question. It's usually due to some sort of irritation and something called post-inflammatory erythema, PIE. Usually there's a little bit of some blood vessels that are there that we may have to zap with a laser, or you could try something like azelaic acid. That could potentially help. Just try 10% azelaic acid. That could help. Will tretinoin help with this kind of scarring? It can help a little bit with the oil production, a little bit with the texture. Not going to help much though, because these are deep, thick scars. You can see a lot of volume loss over here. Not going to help really much for those kind of scars. It may help a little bit sometimes for some ice pick scars, but when there's so much volume loss, it's not going to help too much. What are the risks of Kenalog injections? Kenalog basically could destroy a little bit of your natural fat, and so you have to be really careful when you do Kenalog. Is his skin tone a Fitz 3 or 4? This is a Fitzpatrick 4. How many treatments will he need? So after we did this, we ended up doing another treatment with more TCA Cross and a little bit more Bellafill. And then I'll probably wait a few more months and we'll do another round of laser and TCA Cross, maybe a little bit of Bellafill. We'll see. Let's see here. I'm going to try to get this smaller again. But pretty cool, right? Like this is a thing that a lot of people complain about. Temple scars. A lot of people complain about temple scars. I did a lot with temple scars just today. I was doing a lot. Also, we did a really cool phenol peel today, actually. His results can be awesome. He may end up letting us share. He was kind of on the fence about it, so we'll see. But it was really cool because I did his subcision last month, which I broke up his scar tissue really well. It lifted up now for us to actually break it up. He's Fitzpatrick 4. He's Hispanic male, lighter Hispanic male, Fitzpatrick 4. So it's going to be an amazing result for him because his subcision. So I do phenols, especially with those deep, thicker rolling scars, especially if we break up the scar tissue, lift it up, it's going to work out really well. So I think his results going to be awesome. And he's just recovering tonight. So yeah, he messaged saying he's okay, he's doing okay. Are the results temporary or permanent? So the texture you get to keep. Some of the volume is going to go down a little bit, so you may need to put a little bit more volume in there. So something more, some little bit of fat transfer or more Bellafill, something else for volume is always necessary. How much is fat transfer? I believe like 6,000. I think it's in the office. We do fat transfer in the office. So I believe it's about 6,000. Let's see here. Monet saying, hi, doctor. Is it okay to get laser hair removal on the face before getting TCA Cross and laser for acne? Usually you want to wait several weeks beforehand though. Usually you want to wait a little bit. Can you recommend a doctor in New York City for scar treatment? I don't have anybody that I would know, to be honest with you. Jen is saying, if you're prone to hypertrophic scars, could you still get CO2 laser? Yes, you could. Yeah, you absolutely could. Is single entry point subcision more risky compared to multiple entry points? Well, someone like this patient, single entry point is appropriate and all we needed. But if it was potentially like in the part of the lower part of the face, then maybe yes, we would do a little bit of multiple entry points then to be able to get there. It all depends on where the scar tissue is. If we could get to it with a single entry point, we could do it that way. But if it's something where it's located potentially in more risky areas, we may have to do it from multiple different angles to be able to do that safely. And that's what really matters. Diana is saying, would the keto diet improve collagen production when healing from treatment? Good question. I mean, I had a patient today. She was of Chinese origin. She is about 6 months out, almost scarless at this point. I asked her if she had any special diet. She said none. I had another patient today. She's of Korean origin, and she's 3 months out. It's almost, I've been saying before, the Korean women especially sometimes get really robust collagen response. I asked her also if she had any different diet or anything else that she could potentially add for people. She said no, she didn't change anything. Nothing is different. Doesn't take any collagen supplements. Doesn't do anything else. So I don't really notice much of a difference, to be honest with you, between that. I'm happy for people to try it. If you feel like diet may be a role, I definitely think that you should limit things like dairy so you don't get oily skin, and potentially make sure that you use clean water. So I've talked about that before, where I think that sometimes certain areas there's a little bit too high of concentration of minerals in the water, and that could potentially cause inflammation in your skin, and that could prolong the healing factor, or prolong your. I just watched Wolverine and Deadpool yesterday, so I'm thinking healing factor. By the way, I watched only some of it though. I didn't really think it was. I don't know, it was okay, but there was just like going wow with the healing factor there. So, anyways, so you do like a laser, and then it could kind of delay the healing process if you have irritants like minerals in your water, for example. And you guys watched that. What do you guys think of that movie? I don't know. It seemed like it kind of wore out its welcome a little bit there. Keto diet raised my bad cholesterol levels. Definitely. That's the problem with these like really strict diets like that. I do think that that's definitely one of the big problems there. Is that the keto diet, it's all like meat heavy. And, honestly, I like meat too, but I'm trying to cut away from it. I'm trying to like go into more like pescatarian, maybe potentially. Make going to the movies fun again. Yeah, I would hope so. Yeah, I mean, it was like, otherwise it's an entertaining type of thing, but like it's, so it'll be nice if we all had healing factors. So you saying, I'm getting subcision done next week. Is it ineffective if I don't get dermal fillers? No, I mean, the patient I just did today, I did the phenol on him, and he didn't need fillers. So sometimes I say that, like, I don't necessarily need the filler. We just break up the scar tissue, and now it looks amazing. So it just depends, how much fat loss there is, what we're looking at. And that's why sometimes we have to do it in stages, really. It's not true that you have to do filler with subcision. It's just, you have to do multiple subcision, all that type of stuff. It's just not true. But won't the scar tissue come back? No, it's not true. You definitely do have some scar tissue underneath there, but whether it's pulling down like the way it was before, no, it's not true. It doesn't have to do that. It's just a matter if there's volume loss. I'm not sure if there's volume loss or not. It depends. Bog is saying, any Rex for skin restoration doctors in Chicago? I'm from Chicago, by the way. But I went through a lot of different people there. I have a lot of patients from Chicago. They've done a lot of different treatments from people there. And I can't say that there's anybody that I would recommend at this point, but I'd be happy to, if anyone's a skin restoration person over there, physician over there, let me know. And, I could see, we could talk, but otherwise I don't really have anybody, that I would be able to push. So to be honest with you, it's a very, very specialized field. There's hardly anybody in the country that does this, like hardly anybody. And I do it day in and day out. I have multiple cases, about 3 cases every single day. Some days this week and next week, we're going to be doing 4 cases. It's don't worry. I've been working out a lot, just getting my stamina up. I've been really, really good with that. So I'll be able to do 4 for some patients. It's going to be awesome. I love it, actually. It's really fun just to keep on going and just breaking up that scar tissue. And you want somebody who as patient and want somebody who like loves doing it. There's some people who just view it as monotonous. Some people out there that just don't, you could just tell they just don't love it. They just rush it. They just don't really seem to care about the end result. And I think that's what ends up happening. Can you get rid of acne scars or no? You can make it look a lot better. The goal is to make it look a lot better. That's the point. It's to make it so that it's less visible. This patient is so happy. He did 10 microneedling sessions before he came to me, and wasted thousands of dollars of his money. And finally, he got the results he needed. You know, it's like, it's awesome. It's really cool to be able to have that experience with patients and see just that progress that it's nice right now. It's nicer after a year, nicer after 2 years. It's really cool. You saw Alan over here who was on here earlier. He did it a while ago, and it's gotten better and better. I had my patient last week. She was just like, it's definitely was 1 year out that you could see like the most improvement, which is awesome. And you were saying, I'm 18 and I got the same scars in the picture. What was done there, and will subcision help? Yeah, subcision was needed for this patient. We did talar liberator subcision in this case. We did CO2 laser, we did Bellafill as well, and we did TCA Cross. All those things helped out. How far out are you booked? We have, I think until somewhere in February or so. We do have, slots that we find open because sometimes there's patients that cancel or have to shift things for whatever reasons, emergencies, things like that. So always try to go through our page, go to drqazi.com. You can set up a consultation. We'll be happy to help you with that. Bobby, the esthetician, saying, do you think Accutane permanently alters oil glands, oil secretions? Yes, it could reduce that permanently. Is Shani saying, is mesotherapy effective for acne scars and for people of color? Mildly, not so much. Definitely not the go-to. Was the CO2 fully ablative or fractional? For those thicker edges, it's fully ablative, and everywhere else, it's fractional. Can subcision cause irreparable tissue damage in surrounding tissue? I do it really refined. I just go in certain spots for the subcision. I don't do like a blanket area and use a blade and just kind of like do this windshield wiper method for the full face. So I think that the way I would do it is a lot safer, but yes, potentially there could be damage if you go too deep with these big blades. You could run into risks. Sailor Moon saying, you're definitely the most passionate and dedicated to scars. Appreciate that. And everything that I do, I actually really do love doing, honestly. Every single thing I showcase, I love doing. So it's really fun. Will TCA reduce the diameter of my boxcar scar? Potentially, yeah. If we do in the inside walls of it, it could. We did it for this patient for his boxcar scars as well. It could help. Does fibroblast help acne scars? It's not worth the risk. You really could run into a lot of pigmentation issues and new scarring with fibroblasts. It's just not controlled enough the way you can with lasers. So that's the problem with that. All right, guys, I appreciate everybody. I know last week I was on for a little bit longer, but this week I may not be able to do that as much. So I'll come back again tomorrow, 9 p.m. sharp. I got the new format going. What did you guys think about the new format, by the way? Was this okay this way? Let's see if we'll get like a quick little thing at the last few seconds here. Should we keep it with this way? Some guys on IG, it doesn't really relate to you, but other people, it may have noticed it was a different format. All right, new format was good. Thanks. Awesome. Is Shani saying had a bad experience with TCA Cross? Can this procedure go very wrong if not done well? Yes, I had a patient that was really burned really poorly yesterday, actually, from someone did TCA Cross, a dermatologist in LA area, did TCA. It was terrible. And so yes, it could, but I'm very precise the way I do it. And apparently that person was just like 90% TCA, the whole face everywhere. So it's really sad, unfortunate, but I'll help her out, but it's just unfortunate. Yeah, so you could read the comments better. Awesome. So good. So I'll stick with this format. If you guys feel like we should go back to the old one, we'll know. Canadian Girl thinks that we like the old format better. The old format is on other platforms though, just so you know, FYI, for now. But we'll see. We'll see which way it works out for you guys. I hope TikTok doesn't get banned. We'll see. Hopefully not. Hopefully it's not. I may have to go on other platforms anyway, so we'll see. We'll see what happens. I don't know. I have no idea. Do you guys think it's going to get banned? I don't know. We'll see. Pics are better in the old way. Okay, yeah, maybe. But did you go? You could do wide. Did you do the widescreen way? If you did the widescreen, you should have been able to see the pictures better. By the way, so do the widescreen. You can see it better. Is microneedling or radiofrequency microneedling a good treatment? Not so much, honestly. Not so much. All right, I'll keep that in mind, Canadian girl. And hopefully TikTok doesn't get banned next year. I'm going to still stick with it until the very end, though. To be honest, I love it.